Okay, at the start of a nursing assessment, you come into your patient's room, close the door or close the curtain to make sure the patient has privacy, and you start with hand hygiene. Hi, I'm your nurse today, Olivia. Can you tell me your name and date of birth?
My name is Christian Rosler, born June 23rd, 1991.
Okay, thank you. Can you tell me what we're doing today and where you are?
I'm in a clinic and we're doing a nursing assessment.
All right, thank you. And can you tell me who the president is today?
Donald Trump?
Thank you. So we're going to start out, I'm going to don gloves and inspect the head. So if your patient has hair, you're going to want to go through the hair, check to see if there's any alopecia, check for lice, and basically just go through and make sure the hair is clean. As you're evaluating the patient, you're going to want to make sure you're checking the patient to see if their personal hygiene is good. Make sure they're dressed according to the weather. Dress appropriately for the weather, and then we're going to start by palpating the head. So we're just going to go through, feel for any lumps, looking for any bumps, rashes, or lesions. We're going to work our way down the neck, feeling the back of the ears, and we're looking for lymph nodes, any enlarged lymph nodes. You're going to come through the front and feel the trach, and palpate the thyroid, making sure it's not enlarged, and down the clavicle chain. And we're going to come back up to the trach and ask the patient to swallow, please. All right, and everything looks good here. So we're going to move to the front, and I will start with the eyes. So you want to start by looking to see if the patient's eyes are symmetrical. And we're going to start by checking PERLA, which is pupils equal roundness and reactivity to light. We will take a pen light at this point and shine it from the side of the eye and make sure the eyes dilate or constrict. And once you take the light away and contract at the same time, and making sure they're about the same size. You want to compare the pupil of the eye as well to see if it's within normal limits. So the next thing we're going to do is prompt our patient to go through these 6 cardinal gauges. So I'm going to ask you to follow my finger. Alright, and we're going to check his peripheral vision. Alright, keep looking straight at me and tell me what numbers you see.
2, 3, 1, 5.
Alright, good. So everything looks good with his eyes. We're going to go down to the nose. At this point, I don't have anything to make him smell with, but we would ask him to close his eyes and with something under his nose, ask him to smell to see if he can smell. And what we'll do is occlude one nair and ask him to blow out, and the other and ask him to blow out. Thank you. So next I'm going to go over to the ears. Make sure you inspect the ears and look for any abnormalities. We already checked behind the ears to see if there are any lymph nodes. We're going to do the whisper test for the ears. So please repeat after me and if you hear anything, okay?
99. Cats and dogs.
Alright, and everything checks out there. So next we're going to go down to his mouth, and what we're going to do is check to see if he's had a stroke. I'm going to ask you to smile with teeth, frown, puff out your cheeks, and stick out your tongue. Thank you. I'm going to ask you to open your mouth, and this is when you ask your patient to say ah, and you want to check to see if that soft palate is moving. So while you have his mouth open, you're going to check to see for the gag reflex. I'm not going to do that on you. And we'll check and see if his teeth are looking healthy and normal, which everything checks out. So before we move on, you're going to palpate your patient's jaw and ask him to clench down and open against resistance. Alright? And that does it for the top of the head. We're going to move down to the upper extremities, and pretty much again you're going to examine the skin for the same thing, any rashes, lesions, open wounds. I'm going to ask you push against resistance. Alright, everything seems good. We're going to come down here, and preferably you would have already taken the vital signs, but what we're going to do is palpate his radial arteries bilaterally. don't think he can see. It's fine. I just verbalized it. Okay, so we're going to do a strength test, a grip test first. Grab my fingers as hard as you can. Thank you. And put your arms up like this. And pull. And push. Thank you. And ideally, you want to rate these out of 5 if the patient is strong enough to. So before we move down to the chest and abdomen area, I'm going to check his joints. I'm going to need you to do this and tell me if you feel any pain.
Nope.
And do this.
No.
And everything seems good. Before we move down, again, we're going to check the fingers to see if there's any abnormalities, see if the joints are looking good, look for clubbing, anything like that, which his fingers look great. So next, you'll move over to the chest. You would want to ask your patient to maybe disrobe or take off their shirt so you can inspect their skin once again. And we can start by auscultating heart sounds. So we'll start. Right, once you've auscultated for the heart sounds, you want to do that on both the diaphragm and the bell in the order I just went in. So next, we'll listen for lung sounds. You would start by going through the front on both sides of the body and asking your patient to breathe in deeply once you go to the back. So I'm just going to listen to your breath. Alright, and once you want to listen to the back, you're going to ask your patient to stand up, please. Let's move this chair out of the way. I'm going to need you to turn around so I can show the camera. Actually, this side. So, when you're listening to lung sounds, you're going to start at the bottom. Down here, you'll most likely hear, if it's pneumonia, you're going to hear like crackling or maybe like dull sounds. And you'll move your way over and up this way. So, alright, breathe in deep. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Again. Alright, and can you go ahead and sit back down on the couch instead of the chair? So, at this point, after we've done the lungs and the chest, you would want to move on to the abdomen. Are you comfortable with me showing your abdomen?
Sure.
Okay, cool. So I'm going to ask you to take off your shirt, please. So ideally, when he does this, when we're listening to lung sounds to check in the chest, you want to check the skin on both sides to make sure there's no abnormalities. So when looking at your patient, when they're laying down, you want to see the shape of their stomach. I don't think you can see that, Dr. Nadi. So you want to look at the shape of their stomach, whether it's convex, flat, or concave. Let's move that a little closer. So on the abdomen, the order it needs to go in is inspection, auscultation, percussion, and then palpation. Give me my stethoscope. So once again, I'm going to ask you to put your arm there so I can look at it. You want to inspect the skin like we said earlier. So now we'll just listen, and we'll listen on each quadrant, listening for vowel sounds, either hypo or hyper vowel sounds. Why can't I get this in the right direction? Alright, after auscultation, we'll go ahead and percuss. So the way you do this is take your 2 fingers, put it on the patient, and you're going to be tapping your finger. Listening to see if you hear whether it's dull or not. And basically these sounds will be telling you whether you hear they're going to need to take a bowel movement or not. Everything sounds fine, and then you're going to want to come through and palpate. We're feeling for any distension the patient may or may not have. And while you're down here, you can even move down the patient and feel for lymph nodes that might be in their pelvic area. Sorry if I hurt you. Alright, can you sit down for me? Sit down and straight up. Do you want to put your shirt back on? It doesn't matter.
Oh, it doesn't matter.
It doesn't matter. So, next we'll move on to our patient's legs. We'll go down to his toes, start with his toes. So you're going to check capillary refill. Basically, you're going to press on the toenail and watch for how fast it does or does not come back. You're going to look down at the legs and see if you look for any bumps, rashes, wounds, anything like that. But also you're going to be looking for edema, checking for deep vein thrombosis. At this point, we can palpate the popliteal artery, the dorsal pedis, and the posterior tibial artery. And that just about does it for the nursing assessment. On my project, I had hypertension, so for that you would be using the cardiovascular assessment. Of course, you would check for skin, check for skin moisture, trigger, any clubbing, edema, of course, and you want to look for any swelling or redness. You're going to palpate, of course, heart sounds, take the blood pressure. You're going to want to take multiple blood pressures, 2 or 3, just so you can see if there's a consistent elevation of the patient's blood pressure. It might just be elevated because that one visit because of white coat hypertension. The other thing you're going to want to look for, you're going to want to palpate is the jugular venous. You're going to want to palpate, like we did earlier, the popliteal artery, the radial artery, the brachial artery. You're going to need to do the dorsal pedis as well as the femoral artery. You're going to want to check the carotid artery. Don't laugh at me. The carotid artery, but you're not going to want to palpate these bilaterally. You'll do these one at a time. Don't think I had to say anything else for my project. That was it. Thank you.